Welcome to the Man Amongst Men podcast. Live a life of intentionality, adventure, and brotherhood. Take the inner journey and live out over your edge constantly. Here are your hosts, Dominic and Bryan.
Gentlemen, this is your episode for all things that concern the physical health of your dick today, tomorrow, and for the many decades to come. Dr. Amy B Killen is a physician of anti-aging and regenerative medicine and has one hell of a gangster rap name. She is an outspoken champion of proactive sexual health, so basically addressing your sexual health before there's a problem. She is a wife, a mother of three, and one hell of a human being because she happens to be a close personal friend of both Bryan and I. Now, some of the highest performing men in the world have come to Dr. Amy for proactive treatments for sexual health, including Dave Asprey, the founder and CEO of Bulletproof Coffee, and you've heard Bryan and I talk quite a bit about our love for Bulletproof. Dave Asprey is also the author of the New York Times bestselling book, The Bulletproof Diet. Vishen Lakhiani, who's the CEO of Mindvalley and A-Fest, another group that Bryan and I have participated in and talk a lot about on this podcast. Vishen, you may know him for being the author of the New York Times bestselling book, The Code of the Extraordinary Mind. And Dr. Amy has also worked with Ben Greenfield, the CEO of KION Supplements, also runs the very popular biohacking podcast, The Ben Greenfield Fitness Show. He's an anti-aging maniac and widely considered to be one of the world's top biohackers. And so all of these really forward-thinking, powerful men have gone to Dr. Amy for proactive treatments to tune up themselves so they can be sexually active and healthy for many decades to come. And so in this podcast, we go wide and deep on all of the things that you should be considering. Whether or not you're as healthy as a horse, you've got some issues that you want to work through, there's something in here for you. For example, we give you a 101 overview, Dr. Amy does, on testosterone and how it affects your libido, why you should be taking proactive steps to improve your sexual health right now, even if you feel as healthy as a horse, unveiling the number one cause of physical erectile dysfunction and how declining dick strength might actually be a sign forewarning you of potential future heart issues. Dr. Amy goes into the science behind some lifestyle habits like sleep and stress and how they can enhance or erode your sexual health, and why men shouldn't just jump to the pills like Viagra or Cialis before understanding all of your natural options for improving your sexual health. And it turns out there are many more than even Bryan and I were aware of. We also go into some of the cutting edge technologies that are out there today to improve your sexual health, like GAINSWave, which is a shockwave therapy that basically blasts your dick with sound waves and opens the blood chamber for stronger erections. That's been around for about a decade. And some newer treatments like the Pea Shot, a stem cell injection in the penis that purportedly regenerates sensitivity and erection strength. And then we also cover a couple of topics that might surprise you, like why regularly using Listerine might eventually kill your erections and why I've given up Listerine altogether. And Bryan was obsessed with figuring out the answer to this question about how do you measure your dick according to a doctor? Strap in your seatbelts. A lot of information here that I wish I knew 20 years ago. Our interview with Dr. Amy B Killen. Amy, welcome to our show.
Thank you.
She's Amy to us. She's Dr. Amy B Killen to the rest of you.
Oh, I am so excited to have this conversation. If there's been one consistent question I've had since I was a kid and continues to this day is like, is my dick working the way it should be?
That has been a consistent question for you since you were a kid?
Still to this day, yes. So I think today we're going to get some answers.
Yeah, we have a lot of questions about probably the most sacred part of our body as men, at least that's how I felt for most of my life. And there's never really been too many forums where I've been able to ask questions about, especially as I'm now at 40 years of age. What do I need to consider when it comes to my health, my future? And one of the things that, Amy, that you talk about is sexual performance for today and also sexual longevity for tomorrow. Yeah. Which is fantastic. And so you are a physician of anti-aging and regenerative medicine. What does that mean?
So the anti-aging piece is basically kind of a preventative medicine, like trying to age as well as you can. So it uses a combination of integrative medicine, traditional medicine, and some of the sort of newfangled things out there to try to help you age better and stay alive longer. And then the regenerative part is using stem cells or other similar therapies to activate your own body's healing processes. So basically giving you sort of high-tech treatments to get your body to heal itself, to regenerate itself so that it's better for longer.
Yeah.
I think we're done. I'm going to do all of that. So bring it all on. The new age, the old age, the wow. Okay. Yes.
Sign Bryan up.
Yeah.
How did we end up meeting? Because we didn't meet through this kind of work. We met in a much more exciting place.
We did. We actually met on a shuttle bus, if you remember, at A-Fest. First day, we're at A-Fest. I have no idea what this crazy event is. And Dominic gets on the bus and he's right behind me. And he's talking about his men retreats and his man programs and his
man program.
You got so much man stuff in you.
And there's a lot of emotional talk. I don't even know what's going on. I was like, where am I? I'm in Jamaica. There's this random guy behind me talking about all this men stuff he does. And that was just an introduction.
That was your first impression of me, that I was random.
I thought you were adorable, but also a little weird.
I'll take that. Adorable and weird is a good mix.
And kind of the same today, right? I mean, nothing's really changed.
Yeah, nothing has really changed.
Yeah.
But I do know you better, which is fantastic.
Yeah, and so A-Fest are these big events. You have a great way of describing A-Fest.
A-Fest is if you went to Tony Robbins meets TED Talks meets Burning Man, right? The parties are amazing. The people there are just amazing. And they bring in amazing speakers like Amy, Dr. Killen. Oh man, this is so fun.
You can call me Amy.
Yeah.
You can just call me Amy.
We can call her Amy.
Yeah.
Everyone listening calls her Dr.
I also enjoy Amy B Killen though. It's kind of a cool, but anyways, that's the A-Fest event, and we get great speakers like Amy there. And it's a great tribe.
Yeah. And we did the second one in Sardinia 6 months after that.
Yes.
And that's where we really became really good friends. And we had a chance to see you speak twice on that stage. And the information that you shared was something that I was like, oh my God, as a man, I wish I knew this stuff about my own sexual health, what I needed to know about testosterone, what I needed to know about the future of medicine, like stem cell therapy, and what the options are. We're going to get into all of that in this conversation. So it's really exciting because we're going to educate a lot, but also inspire, I think, different decisions and better habits around this stuff. So maybe to get even a little bit personal for a moment, the reason why this is near and dear to my heart was I'm 40 years old now. For the first 38 years of my life, my dick functioned at the level that I would have expected it to. Just in some cases, I wanted it to tone down a little bit. And then I noticed, I don't know, maybe 18 months ago, 24 months ago, that certain sensitivity was going down. I was having fewer morning erections. My resiliency when I was with a partner after orgasming, or even by myself with orgasming, all those things started to shift. And I knew that it was something beyond just the mental and emotional component, because even when I was by myself, I could feel that something had shifted. And it can be a lonely place to go. It's kind of what do I do? Do I start to buy the pills?
Right.
And that seems to be the one thing that's socially available and acceptable. It's kind of forced down my throat every time I put on an NFL football game. And I was like, I don't feel that's the route that I need to take. And there was a part of my journey that I went on to explore the energetic and emotional components of what I was dealing with. But for the focus of our conversation, Amy, especially where you specialize, we're really going to be talking about the physical element of it.
And we'll talk about kind of the structural, mechanical, physical part of it, which is funny. Whenever I give talks, like the A-Fest talk, for instance, so I went back later and watched all the YouTube. I read the YouTube comments, which my friends were never read the YouTube comments. But I read them, and there were so many people were like, you didn't talk at all about the, emotional part or the sacred sex or the tantric or, any of these things. And I made a point, though, in the talk to say these things are all important, so important. You have to have the emotional stuff and the mental stuff all dialed in because nothing else will work, right? That's the first piece. But once it's dialed in, let's talk about the logistics of the mechanism and how does the blood get there and why is it getting there and why is it not getting there and what can we do about it? So that's kind of what my area of expertise is and not all of the rest of it.
Yeah, right on. And one of the stats you shared in that talk was 40% of men over the age of 40 have some form of erectile dysfunction, and then 70% of those men never get treated for it.
Yes.
Right?
Yes.
And so it's okay, whether or not you have any form of dysfunction or there's anything that's changing, there are some things that I wish I would have known and some tests I wish I would have taken, especially understanding my hormones and my hormone panels and my testosterone when I was in my 20s. So that I could have marked where I was then versus when I was 30 versus 35 and 40. So maybe a great place to start, Amy, is helping us get a basic understanding of our endocrine system, which is that the hormone system?
Yes.
Okay. Testosterone. What is it? Why does it matter? And what's beyond testosterone that we need to be thinking about?
So testosterone is, the most known male hormone. It's the most important, probably for a lot of functions that men have. Testosterone is made by the testes. So the testicles make testosterone. It is regulated by the brain. So the pituitary gland in your brain sends the hormone message down to the testes, and then you make testosterone. The levels of testosterone are pretty high in the production of testosterone until you hit about 35, 40. And then you start to lose testosterone production, and it continues to go down. So that when you're in your 70s or 80s, your levels are pretty low. Everyone knows it as kind of being important for libido, for sex drive. So that's, wherever you look, most people kind of know that. Like, you have to have high testosterone, good testosterone, generally to have good sex drive as a man. People don't know, however, that testosterone is important for so many other things in your body. It's important for everything from mood, making you in a good mood versus a bad mood. It's important for, being able to form muscle and burn fat. It's important for prevention of cardiovascular disease, for prevention of osteoporosis. The laundry list of things is so long. And, it's one of those hormones that just goes down with age. And so it's important to track that so you know where you are as you get older.
Yeah.
I'm getting all kinds of worried right now because I'm not quite 40 yet. So I'm right at that tipping point. And you said a word that tends to trigger me sometimes and the word is testes, simply because I don't know if you know this, but I lost a testicle to cancer. And so now I have one nut, and I'm doubly concerned with testosterone. So do the same rules apply to a one testy guy?
So one nut guy.
A testy guy.
Yeah, the same rules apply. You're still making testosterone with the one. And so you still want to have, eventually have some levels checked. And especially, I think it's a good idea, like when you're in your maybe mid 30s, to get those levels checked. A lot of things can influence testosterone levels. And so, for instance, diabetes or being hyperglycemic, hyperinsulinemic, pre-diabetes even can oftentimes result in or is correlated with low testosterone levels. Maybe if you get your testosterone checked, then if it's low, you can look for what's the cause. Is it because I'm overweight? Is it because I don't exercise? Is it because I'm not doing something with my lifestyle?
I'm right in front of you.
I know.
I'm right.
He's right
I'm not.
I'm not telling you
a specimen, but come on.
He's been eating broccoli.
But there are a lot of things that you can do just with your lifestyle if your levels are low to try to help increase it to make you healthier.
Right. Now, Bryan, have you gotten tested for, do you know what your testosterone levels are?
The last time I got tested was 8 years ago, right after I had my testicle removed.
And that was the only time. That was
the only time. But it wasn't because they don't typically do that when you remove a testicle. But right after chemotherapy, I was having sexual problems with my girlfriend. And so I went in and talked to the doctor, a urologist, and he's like, how's the relationship with the girlfriend? I said, it's fine. Check my testosterone. You check my testosterone. It was high and fine. And then I realized I had a relationship problem. So that was what was causing my sexual issues. It wasn't testosterone. But that's the last time.
See, This is the thing. It's like, it seems that men only pay attention to their sexual health when there's a problem.
Oh, that's true. I mean,
for me,
the sexual health company I run, right? If your dick's burning, you're going to run into the ER and get an STD test and get it taken care of. But other than that, not too often.
Actually, in some cases, you don't run into the ER. You try to ignore it for months, like in your case.
Right. Also, for the hard-headed ones of us, we do that. Yes. Yeah. True.
And do you see that too? Amy, is like guys tend to only initiate the conversation around their sexual health, like especially around testosterone and blood flow and these kinds of practices that you can make sure that you're healthy only when there's a problem first.
Yeah. Well, testosterone, I get a lot of men now are becoming educated about testosterone to some degree, and they'll come in and ask for it to be checked because they're tired, they're run down, their motivation's low, they're depressed, whatever it is. So they'll come in and ask for that. But I do still have a harder time getting men to ask about, how to help improve erectile function. Like you said, beyond taking Viagra or Cialis or libido or whatever, they don't know there are other options. And they're also still really embarrassed to talk about it. And the reason I think it's important, not just because sex is important and we can, talk about that all day long, but problems with sexual performance, ED in men, is often an indicator of something else that's going on. So it's kind of like the canary in the coal mine I talk about. It may be the first symptom of atherosclerotic disease or clogged arteries. Yeah. The arteries in your penis are a lot smaller than the ones that supply your heart or supply your brain. So if you have atherosclerosis all over your body, then your penis is going to be the one that knows about it first because it's not getting blood flow. And so it's like, hey, what's up? This is a problem. So it's telling you that. And if you're not listening, then maybe you have a heart attack in 5 years or 10 years or a stroke. Right. So you really do have to pay attention. It's a part of your body that's, it's a legitimate, part of your body. Let's treat it like that.
It can mess with your mind too, because if all of a sudden something's not working and it truly is biological, and you don't get it checked out.
Right.
There may be 100 other things that go through your mind as far as relationship or eating or habits or whatever. So why not just get it checked?
Yeah. And it's easy enough to do. It's not always easy for us to tell what the problem is. I have a lot of guys in the youngish guy range, mid 30s, 40s. It's probably not necessarily like a severe blood flow problem, although it could be starting, but, figuring out, is it a relationship problem? Is it a porn problem? Is it there's so many other things that can cause issues. But what I tell people is that you're having a problem. Let's try something. Let's check it out. Let's check your hormones and let's see kind of where we are with everything. And then we can make good changes.
Yeah, so let's talk about the hormone thing first. I mean, I don't know if you have a recommendation, but I have no baseline from my 20s to know what my hormone panels looked like then. I don't know what my testosterone and free testosterone looked like then. I don't know what estradiol, and maybe we can talk about what those are. I had no idea what those things were. I can go back to 2017, which was 2 years ago. For someone who's listening, who's like, yeah, everything seems to be working now. During your next physical, would it be a good recommendation to say to my doctor, hey, can you please throw in a hormone panel? And then what to ask for?
Yeah, I think you could certainly talk to your doctors about that. Part of it depends on insurance and what they're going to cover. And sometimes in younger guys, they're not going to cover all those things. But I do think having a baseline is not a bad idea. Like, you don't need to have testosterone checked, every year for your whole adult life by any means. But it's nice to know when it's going down. However, the caveat to that is even if you have pretty normal levels, you can have, testosterone receptor problems or other things that are sort of giving you the same symptoms of low testosterone. So it can be really tricky. It's not always about the actual numbers. There's a lot of things that kind of play into it.
Is that testosterone receptors, is that something that can be tested for, or is that just
no, not easily?
Right.
Yeah, it's something that they're still kind of researching and figuring out why some men who have testosterone levels of 300 feel great and do great and don't have any problems, from a like just looking at you standpoint, but other men who have pretty high levels feel miserable. And so part of that may be the way the testosterone is actually interacting with the cells themselves and whether or not they're able to cause a series of events that create the changes that we're looking for.
What is the average range? Is it somewhere between like 700 and 900? Is like you're in range?
It's depending on the lab, but it's usually about 300 to about 1100. It's age dependent. So the lab will look at your age and will give you a number in between there and say, this is what your normal level is. What's interesting about all these lab ranges is they take the population of men age 18 to 100, and then they plot out what all the testosterone levels are. Like, they make the, standard deviation kind of bell-shaped curve. And then they look at the top and bottom 5%. Like 2.5%, and they consider those to be abnormal. And they say everything else is normal.
Wow.
And so if you think about that, you're taking an 80-year-old and you're saying, his testosterone is whatever it is, 300 or 200. That may be normal for him. According to
tests. But you're plotting me on that same graph.
But I'm plotting you on that same graph. And the 80-year-old may feel pretty miserable with his level at that. So, one of the things that we do with bioidentical hormones is, and this is true for testosterone as well as thyroid and other things, is we look at the person and their symptoms and what's happening with them. We look at the numbers and we kind of use those things together, but we're trying to, in general, get you to the higher end or the more optimal end of that number range so that you feel as good as you can feel.
What would people buy from that as part of it? Is it testosterone pills or?
It depends. Yeah, it depends on the person. So a lot of times we can just do sort of lifestyle modification. There are a lot of simple things that you can do. Like if you sleep more, for instance, a lot of men don't sleep enough. People don't sleep enough. You make testosterone while you're sleeping. You make growth hormone while you're sleeping. These are things that make you feel really good. And if you don't sleep enough, then you don't make those hormones, or not enough. So you can actually raise testosterone by about 10% just by getting enough sleep. Exercising increases testosterone. Having sex increases testosterone. There's all kinds of things, certain branched chain amino acids.
To sleep or have sex then? That's the real question when you're looking at raising your testosterone. I'm sorry, I need to take a nap real quick.
And then
have sex. Yeah, it's a win-win.
Decreasing stress is a big one because when you have a lot of stress, your body makes cortisol, right? We've heard about cortisol. Well, cortisol, when you're making it, it's actually stealing some of the ingredients that are used to make the sex hormones. So if you're stressed out all the time, you're like strung out on stress, your body is not thinking about sex. And so it's not making testosterone. So lifestyle stuff is the most important starter. And then after that, there are all kinds of medications we can do, things that could increase your own production of testosterone, like HCG or Clomid, or we can give you testosterone in the form of an injection, a pellet, a troche, like all different things.
So something that strikes me is, what's the barrier to entry? Injections scare me, especially maybe directly into my penis. I'm not sure if that's how it works.
They don't go in your penis.
Okay, right. Great.
I mean, I do other injections that go in your penis, but not the testosterone.
Okay, not testosterone.
That's the Pea Shot.
The Pea Shot.
Pea Shot we're going to get to. Okay, all right, great. For a guy that might be interested in something like this, how long does it last? How long does it take? Is it something I have to do the rest of my life? Is it a cream? How hard is this?
Yeah, that's a good question. So testosterone therapy itself, I usually, in younger guys like you guys, usually we start with other things. So again, lifestyle or other like medications that just increase your own production. So the HCG, the Clomid, things where you take it a couple of times a week and then it tells your testes, hey, we need more testosterone, and then you make more testosterone. As you get older and you lose the ability to make as much testosterone just because of age, that's where testosterone therapy comes in. And there's different options. You can do anything. You can do a daily cream. You can do a weekly injection. I like pellets a lot. I put pellets in a lot of patients, which are like these little, almost like little grains of rice-sized testosterone beads.
So once I start this, sorry, I'm just curious because once I start this, am I on the train Like, am I on a testosterone train for the rest of my life?
Yeah, I mean, if you're taking testosterone, you can stop at any time. But what happens that's bad about it is it does suppress your own production of testosterone. So, if you already are making a fair amount of testosterone, you don't want to start therapy with testosterone because it will shut off your own production. Because your body's smart. It's like, oh, well, we're getting it from somewhere else. We don't have to make it. Like it's like lazy. So that's why other things are the good starting points. But once you get to the point where you're 55, 60, 65, and you're not making much testosterone, that's when the idea of supplementing is a good one.
Got it.
I got a few good years left.
You got some good. You got at least a couple of good years left.
Just a couple. Yeah. Oh, man. Okay. I think we've got the baseline understanding of testosterone, which is great, and maybe some places to go into that you spoke about in the AFES speech, which is online. What's the title of that talk?
I don't even know.
We'll find it.
I'll look at it.
Yeah.
Show note that thing. But you talked about definitely blood flow, and then you kind of hit on this a little bit before, right? Like some of the plaque that builds up in some of the veins and arteries. And then also nitric oxide. So let's hit those two.
Okay.
Maybe start with the blood flow around, like, what do we need to know, one-on-one level understanding of how blood flow affects our dick strength?
As you probably know, your erections are caused from blood flow, which is actually fairly new information. A few hundred years ago, they thought that it was just air going into the penis that was causing that. It's a pretty funny story, but it's blood. So you have to be able to get the blood in. So as you get older, a couple of things happen. One is that you have atherosclerosis. So the blood vessels, the arteries that carry the blood to the penis become more narrow. So you have less blood going in. And the other thing that happens is that the cells inside the penis, so you have these like erection chambers called the corpora cavernosa, which are like these erection tubes, I call them. That's what fills with blood. They're all elastic. They expand. The cells inside of there start to die. And that comes with age and bad choices and bad living. And so as those cells die, those chambers become less elastic. And so you're not able to get this sort of full erection. And because of that, the blood actually flows back out of the penis much quicker than you'd like it to.
Then the symptom is you don't have a hard
Yeah, you can't maintain an erection.
Okay.
So that's the most common form of erectile dysfunction is that they call it venous leak, but it's actually not a vein problem. It's just that the cells in the penis itself are getting old and not as elastic. The blood is just not staying in there because they're not stretching out that tissue enough. So blood flow, whether it's not enough blood coming in or too much blood going out, is the primary cause of ED.
Now, is this something that can be reversed through whatever it may be, through like working a muscle, like through breath work or through maintaining more erections more often during the day? Like, I don't know. Is there something that guys can do?
I'm just picturing all the breath work you're going to be doing later. You're going to be standing on the floor, like just like doing hours of breath work.
I'm not talking as much on this podcast because I'm starting right now.
Yes, these things can, for a lot of people, actually at this point now be reversed or at least improved with combinations of things like shockwave therapy, like GAINSWave, which is low intensity shockwave therapy, which can be done by your doctor, or the things like the Pea Shot, the PRP or stem cell treatments. So all of these treatments are basically changing the health of those cells in the penis, improving the blood flow, and can make lasting changes to that actual organ.
Yeah, and we definitely want to go deep into both of those, the shockwave therapy, the GAINSWave, and then the Pea Shot. Correct me if I'm wrong. Were you asking, like, is there something we can do before that?
Oh, before.
Right.
Yeah,
So
can I hang 10-pound dumbbell for my penis and then do Kegels? Or these are just my ideas. I'm not a doctor yet.
Right? So like one of Brian's favorite books is The Multi-Orgasmic Man by Montauk Chia. And we saw some video about him where he's like, you need to rub the penis 100 times.
How many times do you have to rub the penis? That's my question. How many
100,000 times. 100,000 times. The things you can do are sort of the common sense things that go along with being healthy. Low glycemic diet. Sugar is the evil of all things, including it's like the destroyer of your penis.
Why?
Because sugar leads to atherosclerosis. It leads to plaque. It leads to inflammation. That's, blood flow. We got to get the blood there. And if you have clogged arteries, you can't do it. So sugar is the main thing now that we know is probably responsible for most atherosclerosis.
I absolutely love cookies. You know this about me, Dominic, and sometimes I'm a binge cookie eater.
Yeah.
But now every single time I look at a chocolate chip cookie, I'm just going to think limp penis.
Exactly. Speaking of which, smoking. Hopefully people are not smoking as much these days, but I always tell people I feel like cigarette, boxes should have a picture of like a limp penis on the front of them.
Why is that?
Because it's so bad for your blood flow. It's so bad for the blood vessels. There's atherosclerosis, but it also just smoking in general, it closes off your blood vessels. That happens all over your body. But again, your penis is super sensitive. So smoking is really bad for you. Obviously avoiding chronic illnesses, things like diabetes, high blood pressure, high cholesterol. These are all risk factors for heart disease and, heart attacks, but they're also risk factors for ED.
Yeah.
So most of it's lifestyle stuff. Increasing nitric oxide, we've talked a little bit about.
Yeah, and before we get to the next, I definitely want to go into that inflammation, because that's a word that we hear all the time now. Like inflammation is the worst. Deepak Chopra, when he came here to the assemblage to speak one day, he said that inflammation was like the single biggest problem that he saw. And he wasn't he an endocrinologist? Like he was a doctor.
I think so. Something, right? Yes.
Let's just say someone's been down that path of eating too much sugar. When you then say shift your diet, remove all the sugars, can inflammation be reversed naturally? or has so much damage been done that there's certain things that can't be undone?
In general, a lot of it can be reversed naturally. And certainly if you get to a point where the inflammation has caused some other disease, you're right, it's linked to, or as being a cause of almost every disease that's out there, from Alzheimer's to heart disease to, to everything. It's interesting because inflammation is a normal response. It's a normal way that your body heals from something. So for instance, if you have a bacterial infection, inflammation basically is your immune system responding to that bacterial infection and throwing itself at the infection to get rid of it. So you want to have some inflammation. That's normal. But what's happening now is we're doing things to our body that is causing a chronic state of inflammation. So your immune system is always revved up. And so it's like attacking. It's doing all this attacking, which is a lot of the reason we have autoimmune disorders. Your body's attacking itself. So inflammation is a big problem. A lot of it's from diet, certainly. Stress causes a lot of inflammation too. Lack of exercise, and just a lot of things that we're doing, all of us, on a daily basis, is essentially leading your body to sort of live in this inflamed, think of like an angry, red, unhappy state. Right. That's how I think of it. And that's what's happening in your body. But yes, you can definitely quell that by making good choices and hopefully prevent some of the diseases that go along with it.
Got it. Okay.
Sorry to scare you.
No,
I feel like you guys both have these eyes like, oh my God.
Oh, we're taking it all in here.
What have we done?
Yeah. Just trying to think of how much destruction I've done. That's
I might just get rid of it.
What? Get rid of what?
The penis. Just get all together.
Give it away.
Not worry about any of this.
Yeah, it's not worth the trouble.
My life would be different.
It would be different.
You mentioned nitric oxide?
Nitric oxide.
Is that it? And so I run a sexual health company specific to STIs. And a lot of times we talk about things to eliminate or reduce the chance of an outbreak, like herpes. Nitric oxide is on that list. Mm-hmm. If you have anything to say on that, I'd love to hear it. Or is there anything else besides nitric oxide that can be used for the same purpose?
Yeah, what is nitric oxide? Why is it important?
So I can tell you why it's important in general. I don't know specifically why it works or how it works with herpes infections. But what it is in general, it's a compound that causes your body to open up the blood vessels. It causes a lot of things. But one of the things it is, it vasodilates your blood vessels. So it opens up your blood vessels. So the reason that's important for ED, obviously, is that you need those blood vessels to open up in order to have an erection. So it's one of the signals that tells your penis, hey, we need to have an erection right now. And as you get older, again, after like 35 or so, you stop making as much nitric oxide. So it's made by the cells that line the blood vessels in your body. So you have less healthy cells, you make less nitric oxide. And so now you've got not only blood vessels that are more narrow because they're filled with plaque, with atherosclerosis, but you also don't have the signal to open them up. So it's like a double-edged sword. So one of the ways that medications like Viagra and Cialis and all these medications work, they prevent a downstream effect that essentially causes nitric oxide to stick around longer. Which is great, right? But if you don't have enough of your own nitric oxide to begin with, those medications are not going to work.
Aha.
Interesting. Dom, have you taken any of those pre-workout powders? A lot of those have the NO in it.
Yeah, I have something called Pure Pump or something like that.
And it's wild. You feel it you feel it in your arms, you can feel it certainly.
Yeah. So it makes sense for working out. You want good blood flow to your muscles and to, and so nitric oxide can be used, for all different purposes, but it's definitely something that I recommend anyone who's over 35 or 40, either making sure they're eating enough foods that can be made in nitric oxide, which are things like green leafy vegetables and beets and pomegranate and, some of those kinds of things, and or taking a supplement.
Yeah, and you also mentioned that there are some things that could inhibit nitric oxide production. Like you told me Listerine was one of those things.
Yes, it is. Listerine's interesting because it kills the bacteria in your mouth, which sounds like a big good thing. But the problem is some of those bacteria are responsible for the first step of converting the nitrites into nitric oxide. So you actually, it doesn't mean you can't ever do it, but in people who do it frequently, Listerine frequently, you may not make as much nitric oxide.
Got it.
I can't remember what we were testing, but when we saw you at AFest, you gave us these little strips to put in our mouths.
Yeah, they're nitric oxide. Nitric oxide is in the saliva, and you can test it with those little strips.
So you go to Walgreens, go to CVS, and get these little strips, put them in your mouth, and test.
I don't know if CVS has it, but I know Amazon does. If you just look up nitric oxide test strips.
I remember mine was abysmal. Mine was the bottom of the barrel.
Yeah, it's common. Also, medications like the PPIs, which are the acid blockers, like omeprazole, for instance. A lot of people take them for ulcers and ulcer prevention and heartburn and things like that. Those are really bad for your nitric oxide too, because again, you need the acid in the stomach to make the nitric oxide, and if you decrease your acid, that can be a problem.
These test strips look like they're pretty cheap, like the Berkeley test nitric oxide saliva test strips, 10-pack for $9. These are something that you can have on hand, and then you can see if there's a deficit.
Yeah.
Okay, so the things to take a look out for, Listerine being one. Is there another a regular household item that could be a culprit as well that we want to stay off of?
The main ones are the acid blockers for your stomach, and then you can use mouthwash, just maybe don't bathe in it.
What about alcohol?
Alcohol can be bad for other reasons, but I don't know how it affects nitric oxide.
Okay. And then the foods were the leafy greens, beets, pomegranate. Are there anything else?
Yeah, there's a whole list.
Okay.
Google probably knows it. I mean, L-arginine is one of the precursors that is a supplement that's often used to increase production. It can help, but after about age 40, you can't make your own nitric oxide quite as well. So I like a supplement called Neo 40, which you can get on Amazon. I don't have any stake in the company, but they have some good research behind that one as well.
Very cool. What do you think we take a turn into the future? And actually the future is kind of now, right? So and I think what I mean by that is some of these newer treatments like shockwave therapy, sound therapy. So maybe we could talk about like exactly what that is. And also the Pea Shot, stem cell therapy. You've treated some really high profile people, like cutting edge biohackers. Who are some of the people that you've worked with on some of these therapies so far? So
some of the most recent people are Dave Asprey from Bulletproof and Ben Greenfield. These guys have had their own, they taped it and they made their own podcast about it. So I can talk about them. There have been a number of other people as well that we've treated, but yeah, we've gotten a lot of good business.
Yeah. And Dave Asprey's wife also, you did what was called the O shot. We'll get into that also. But what was her quote that you have? The toe curling.
Oh yeah. She talked about after the O shot that she experienced toe curling orgasms. And basically that was reminiscent of, being 20 years old again.
Totally. And what's really cool, this is, I think, what's interesting. Before we talked about men don't necessarily pay attention to this conversation until there's a problem. And the people that you're talking about, like a Ben Greenfield, a Dave Asprey, Vishen Lakhiani, the CEO of Mindvalley, and also the New York Times bestselling book, Code of the Extraordinary Mind, also got the Pea Shot, stem cell therapy, right?
He got stem cells. I can't remember if we did the Pea Shot. We might have. It's been a few years on him, but he definitely got some stem cell injections by us.
I remember he showed pictures of like him laying down and there was like something on his back. And all these people talk publicly about this. So like you have the consent. But what was interesting about these folks is not that there was a problem. It was more like hey, this is something either maybe potentially preventative or something that could enhance something that's already good.
Yeah.
And so let's get into all of that and wherever you want to begin. I think that this is a fascinating time that we're in right now.
So I'll talk a little bit about what the shockwave therapy is and how that pairs with the Pea Shot and then how we use those things. So shockwave therapy, the protocol I use is called GAINSWave. It's pretty popular here in the United States, but the sort of generic name for it is low intensity extracorporeal shockwave therapy, which is a full mouthful.
GAINSWave's easier.
Yeah, GAINSWave's easier. This is actually a pretty cool therapy. It's been around for at least 10 years, well studied in Europe, lots of studies on it. But basically it uses high intensity sound waves that are delivered, at your doctor's office through like this sort of gun-shaped apparatus. It sounds like a jackhammer, but basically it sends the sound into the penis and it causes a micro trauma. So like a little tiny bit of trauma, you can't feel it. But what that does is it tells your body, hey, we got to heal this trauma. And so you get stem cell activation, you get better blood flow, blood vessel formation. You get increased nitric oxide in the penis, all of these things that your body's trying to improve the health of that tissue. And so after a series of these treatments, men have significant improvement in firmness of erections and lasting power and sensitivity and just ability to sort of get an erection like on the fly. It's actually regenerating the tissue, meaning that it's helping your tissue, your penis become more youthful, which is, I think, pretty phenomenal. So, and then the other thing that we do, it works in actually a similar way, is like the Pea Shot. The Pea Shot is traditionally just PRP, which we get from your own blood and from the growth factors in your blood. We also, at my office at least, do the Pea Shot with like stem cells or other exosomes or things like that. But it works in a similar kind of way, essentially telling your body, your own stem cells, hey, we need to repair this tissue. Like, let's get some good blood flow in here. Let's repair these cells in the erection tubes that have started to die off. And so you do a series of these treatments, and we are actually sort of turning back the penis time on people and getting them back to functioning like they were younger.
I'm 38 years old. My penis is more like 28.
More like 78.
not after killing gets done with me.
right.
It sounds like same question I had before. Is this a series? Is this 1 or 2 or 3 injections, or is this something I'm doing the rest of my life?
You do a series to begin with. With the shockwave therapy, you're doing at least usually about 6 sessions. Then you at least do 1 or so of the Pea Shots. And then most of my patients I have come back every few months just for kind of like a single session, with the idea being that you're going to keep aging. So you're kind of fighting against your body here, right? You're going to keep aging. So if we can continue to give you the signals to help you sort of reverse that aging, then maybe we can stave off ED from developing or reduce it, make it take longer to happen. So we do have a lot of younger guys who are in their 30s maybe, who don't have problems, who just want to have, better performance and potentially, prevent some of these things down the line.
Let's dive deep into each one of those. So the GAINSWave or the sound wave therapy, right? If I remember correctly, Ben Greenfield wrote a pretty funny article about this.
Yes.
He allows you to come into the doctor's office with him. And he was just like, okay, so I sat down. A beautiful woman comes in and asks me to drop my pants. This is what he said. Like, and he goes, she slathers this numbing cream all over. So and he was like, okay, it was painless. And then the gun comes out.
Right.
And the gun doesn't touch you. Is that correct?
No, it does. It does touch you. It does touch you.
Okay, so it does touch you. And then it's like a 20-minute thing?
Yeah, like 20 to 30 minutes.
20 to 30 minutes. And then pants go up and he leaves, right? And I remember him saying something like, the strength of my, I don't know when this kicked in.
Well, wait, he talks about his grandmother at some point. Do you remember that?
No.
He talks about going to dinner with his grandmother that night.
Yes. He's got a major world-beating erection at the table.
Yes.
That's
what he
right.
said.
So it happens that fast. So
Well, it can happen that fast if you're young and healthy and don't actually have any problems. For people who have actual dysfunction, it takes a series of these treatments. It doesn't happen quite that fast.
Got it.
But
Still, Grandma was
but you
young
do
when it
get
worked.
some increase in testosterone right then.
Yeah. I mean, well, so if you don't know Ben Greenfield, he's like a human cyborg. I mean, the guy's like the best physical shape, like, biohacker in the world. So I'm not surprised that happened.
Yeah.
Okay. And he was just like, this thing, like a superhero erection.
Yeah, that's what he said. He described, some serious, which is great. I do tell patients, like, maybe don't aim quite for the grandma erections. Like, let's just get you back to getting good function when you don't have as much.
And this has nothing to do, we're not talking hormones at this point. We're talking purely physical structure.
Physical structure, yeah. I mean, the hormones actually is interesting because the testosterone, which we know is important for sex drive, it turns out it's actually also important to keep your penis healthy, like the cells in the penis. So men who have low testosterone for a long time are known to have less of those stretchy elastic cells in the penis itself. And so it's all tied together. I mean, there's not just one thing you can do, but yes.
And that's the thing I want to be clear about is like, this can be really confusing because like you just said, Amy, it's all tied together, which makes it really difficult to pinpoint like one culprit.
Right.
So like I was showing you my testosterone panels before we started, and my total testosterone numbers, before I went and got tested and I started to notice that shift in my sexual desire, I thought that maybe my testosterone levels were low. And then I was like, oh, okay, like 1250 and then, 1235, 1418, like those were 3 different tests that I took. Those are pretty good numbers, at least just looking for my age without having any kind of testosterone treatment. And so that was like a bit of a dead end for me in that sense. Where I was like, okay, well, I kind of was hoping so that I could go and look at that. And then over the course of the past year, I've done, it's almost like a kitchen sink worth of stuff, right? Okay, let's remove the Listerine. Let's stop eating soy. Let's stop eating flaxseed, which are like these exogenous estrogens that like could screw up your hormone production. I started doing some supplementation with like a Chinese specialist, like an herbalist, all of these things. And they actually did make quite a bit of a difference for me. Not like back to exactly where I was before, but it makes it complicated. And the other thing was I got really frustrated when I went to my doctor because like he was a general physician. And he wasn't a specialist in this either. So like he could give me surface level guidance around this stuff. And it seemed to conflict with a lot of what I was reading. I suppose what I'm trying to say here is like knowing about all of these things that we're talking about, which is the testosterone, the blood flow, the nitric oxide, the GAINSWave treatments, and the Pea Shot, which I definitely want to get into in a second here. Just like kind of understanding the spectrum of it and understanding you may be overwhelmed by the conversation at first. And there are some really good resources. Anything with Dr. Amy Killen in it, if you Google that, is a great place to start. Ben Greenfield has a lot of like specialized, very detailed info on it. If you want to get like deeper into your research, that's the place to go. And it's not going to be
I like knowing, Dom, that there's like bullets in the chamber. I like knowing that there's things out there that I can do. There's something I can do today to start diet and exercise and everything else. And then, we can test for the diagnostics, and maybe it's a testosterone thing, maybe it's a nitric oxide thing. And if not, then great. Now we can go get the penis sound thing. So what is it? The shockwave.
The shockwave.
Also, these names of these things are very aggressive. I would suggest maybe something a little softer.
I'll tell the people at GAINSWave.
Yeah, thank you. Yeah.
I mean, honestly, I think you guys, as part of your research for this podcast and other things, you should go and get some GAINSWave treatments. You will.
Is there any detriment to doing that?
No, that's the thing. There's none. Absolutely
Healthier,
safe.
younger penis.
And when you say
It's
none,
so safe.
is that based on the 10 years of?
There's about 40 studies and 10 years of research just for ED. Actually, the shockwave therapy, you can use it for all kinds of things, from wound healing to, ischemic heart disease. But just for ED, there's a bunch of research. The worst thing that can happen is you might get a little bruise. And that doesn't even happen for most people unless you're on a really high dose of blood thinners. But for most people, nothing. No bruising. I mean, you walk in, you get the treatment, you walk out, and aside from maybe having a numb penis for a couple of hours because you use numbing cream, there's no downside.
Does insurance cover this? Is there?
That's the downside. It does not. No, insurance is not, right now, does not cover it in the US. So there is a cost involved. Mm-hmm. And I guess that's the actual only real downside. I think that this will become standard of care, and every urology office and clinic and hospital that treats ED will do shockwave therapy. Absolutely. In Singapore and other countries, they already are doing it in their hospitals. But right now, you have to kind of find people who are doing it.
And just to be clear, this is not something we can do at home. This is something we need to go to the doctor's office for.
That's actually a good question. I have patients who call me and they're like, I want to buy a shockwave machine and have it at home. Most people go to the doctor's office because the machines are pretty expensive. It would be a lot of money for you to have for a home machine, but you actually could do it at home.
I remember when I played baseball, they used to have that machine in the training room that the shock. What were those things? The electrostim.
Oh, right.
And then baseball team.
Yeah,
the electrostim on my back and legs, and then they gave me a little portable one for home. So I was thinking maybe at the doctor's office there's like this big expensive machine, and it's a little tiny.
I mean, there
Shockwave
are
at home.
portable versions. I've heard patients tell me they have them at home. I have no idea how effective they are. I probably wouldn't spend your money on that. But it's an easy enough treatment that, medical assistants can do it. Like, it doesn't have to be a doctor who's doing it. It's not a dangerous thing. You can put this therapy really like anywhere in your body that you want to do.
How much would, say, I know it probably differs by region, but like, say, 6 treatments, which is, it sounded like kind of a recommended way to put it.
Yep.
How much would that cost?
About $3,000.
$3,000.
For 6.
Okay.
Is it kind of go like that? Like, is it $500 each time you go, or is that number
Approximately.
drop?
I think if you do a series, it depends on where you go, but a series, if you did more, like 12, the price probably comes down per treatment. That's about right. If you're doing GAINSWave itself, which is the protocol that most people use.
Dude, I think to take Dr. Amy's advice, we should go do that and then schedule dinners with our grandmothers.
In.
You down for that?
I'm in. That's the true test. That's a real litmus test.
Yeah?
Yeah.
Okay. Pea Shot. So,
Yes.
so Pea Shot, now we're talking like stem cells.
Yeah, and PRP. So the Pea Shot is an actual shot. This one is in your penis, so this is different than testosterone. But we're using a very little, skinny, tiny, thin needle and injecting right into those
And
erection
you're
tubes.
laughing right now. Is this a question you get often?
She's laughing because, like, I remember
I
the
do. I
picture
get
from her
this question
slides.
all the time.
Yeah,
There's a banana. There's a banana that you have a picture of one of your slides with the needle going into it.
I do
and
have that,
every man
yeah.
in the room cringes and you call that out. I cringe.
And I have the lion too, like the before and the after lion. He's like boring.
Yeah.
It sounds much worse than it is. The numbing cream works really well. I mean, if anything, it's a little tiny pinch, but it's mild. It's really easy. But we're essentially injecting either PRP, platelet-rich plasma, which is coming from your blood, or for sort of the souped up version, stem cells or other kind of similar types of therapies.
Why would you do one versus the other?
There's more research in humans for ED on different types of stem cells than there is for just PRP right now. However, there are a number of animal studies with PRP and a number of studies with stem cells. So they both seem to be very safe, but stem cells we think are probably a little bit more effective than just PRP.
Okay. Is there like a cost difference between them? Like, why would someone choose one over the other?
Yeah, stem cells are more expensive. I mean, PRP is just your own blood. There's a cost involved in centrifuging it and using the kits that we have to use and some things like that. But it's maybe $1,000, depending on where you're going. But stem cells are going to be, a couple thousand at least.
For one treatment.
For one treatment.
This can all be done in the U.S.
Yeah. Yeah, this is in the U.S. And I mean, really anywhere, if you just look up, Pea Shot, which stands for Pea Shot, there are providers all over the place with varying, degrees of experience, but probably most of them are going to be really good.
Pea Shot with stem cells is a few $1,000s, like $2,000, $3,000.
Yeah, somewhere in that range, depending on where you go. And that's not something that most people are doing. So that's something that we do in our office in Park City. I know there are a couple of people out in California doing it, but it's not everyone is doing that right now.
Not everybody. Yeah, so there's only a few places you can go to get that.
Right.
And you're one of the very few. You're basically like the go-to from what we've researched.
I am a go-to.
A go-to. Okay. You don't have to call yourself the go-to. We'll call that.
You're my go-to for sure. Yeah.
And how many of those treatments do you recommend? Is that once every 6 months, every year, every 2 years?
With the PRP, I have some patients who love it so much. They come back every few months, but really PRP generally tends to last a year and a half. So you probably don't need to come in very often. Same thing with stem cells. You're looking at probably a year and a half, 2 years, depending on how quickly you're aging. So part of it has to do with what else you're doing to keep yourself healthy.
It's basically get the treatment, things are like all cell systems go, and then over a period of time, maybe like they start to notice a little bit of a dip and they're like, let's come back in for a tune-up.
Yeah, exactly.
Okay.
We got options.
Yeah, we do have options. Jeez, man. I'm thinking about all this stuff. Okay.
If we're done with the Pea Shot stuff, I have some other like medical-ish questions.
Do it.
Is that cool?
Yeah.
Okay. All right. So Dr. Amy B Killen,
Yes. Brian Stacy, Mr.
I so appreciate the energy that you bring here and the knowledge that you have is amazing. And I'm thinking you can help us out with at least one more thing. This is something I did in high school. And I don't know if there's a technical way to do it, so that's what I want to ask.
I'm getting really nervous here, by the
Yeah.
way. Like, what
I
in
did
the
all that shit
world
in
did
high
he do in high school that he doesn't know?
Well, I mean, that's the thing. I did it in high school, and I've done it semi-regularly since. Like once every few years, I'd say at the very least. And that's just something I think a lot of guys do, which is measure their penis.
Okay. Okay.
Like get the ruler out.
It's going to know where we're going. Yep.
Right. And so the question I have is, I don't know the right way to do it. Because if I do it from the top, right, I get one measurement. If I do it from the side, I get another measurement. If I do it from the bottom, I get another measurement. Now, I would prefer to say the proper way to do this is from the bottom or the side because it looks longer.
Sorry. This is a great question.
What's the proper way?
The main way I would say the most important thing is to be consistent with how you're doing it, but probably.
I don't care about how, I want to compare against other dicks.
Oh, I see. You want to like go out on the,
Am I average? Am I above
on the
average?
interweb and see what's
Right,
happening with
right.
that. I don't know that people out on the interweb, as my grandmother calls it, they're not all doing it the same way, but I would say from the base from the top. From the top at the base, because you can get all the way down, you can get right up next to the base there. There's no like scrotum or other things that are in your way, and then measure it from there. And most people will do a measurement, flaccid, as well as a measurement when they're erect, and, have 2 measurements.
What's the grower versus shower ratio? Do you know?
Oh, I don't know.
Oh, interesting.
I should know.
What does it mean to be a grower versus shower?
Yeah. The definition? Some people I have a friend, definitely, every time he wears shorts, flaccid, his penis is right there the entire time. But as it's been told through eons and stories that it doesn't get much bigger than that. That would be a shower.
Yeah.
And I like to think that that's true. I would put myself more in the grower category, which, quite frankly, if you think about like Transformers, how they are small and they get really big, like my penis is more like that, where it's a little smaller normally, but then gets bigger.
Yeah.
So what I'm looking for is if I measured it,
Bryan wants everybody to know it gets bigger.
Yeah, I didn't say big. I just said bigger. So yeah, if I measure flaccid and then I measure hard, there's going to be a difference in size. Hopefully.
And so that's usual. Yeah.
And that margin is what I'm curious about, like what makes somebody a grower versus a shower.
Oh no, there's Montauk Chia talks about this in the book. There's something about like cartilage, and I'm going to totally butcher this, but like I think that if you are a grower, you have more cartilage or something like that than like elastifies. I don't know.
I do not have any idea.
Okay.
I know, in general, people grow. I don't know like what the numbers are though, as far as like how much and who doesn't. And it should be a research paper that you guys work on.
Yeah. Okay.
We're doing it.
We're on it. Okay.
I mean, we run an event called the Discerning Dick. We should certainly know these things.
We will be measuring from the top based on Dr. Amy's.
Oh, it's the worst. That's the worst measure.
Yeah.
And one life hack here: if you are measuring and you have any kind of curvature, make sure you squeeze it so you get the full.
Right, squeeze.
You don't want the curvature in there while you're measuring it.
Yeah. You're going to lose. I got you.
I'm glad we've had this conversation.
Okay. Well, I think a really appropriate transition is this last place about. This is going to be a real smooth transition. So
far, there's been some really excellent transitions.
Yeah. Well, here's another one coming right at you. One of the things that we love about having amazing women on our show is giving our audience exposures to women who are just like killing it in this world. One of the things that we didn't really even reference, Amy, is that you are a wife, a mother of 3. You were an ER doctor for 10 years before you transitioned into this work. And while you were an ER doctor, you were also like responsible for 3 kids under the age of 3 at one point.
Under the age of 2 at one point, yeah.
Under the age of 2, while your husband had to move somewhere temporarily for a new position. What you've been able to do has been so extraordinary, and Bryan and I admire it. And you also have this energy in life and a vibrancy to you that living that kind of life could have really, could have taken a toll on you. How did you, and I know you talk about this in the talk where like you were living off of caffeine or Mountain Dew. How were you able to make that transition and find balance so that like your world is just thriving now? How were you able to do that?
First of all, thank you for all those things you just said. When I was in the ER, towards the end, I was working like a 4 a.m. shift. So I get up at like 3 in the morning, and I had 3 kids under the age of 2. And my husband had moved out of state because he had a job. I was back to work like pretty quickly after having all the kids. I was just kind of trying to survive like from day to day. Like I was drinking a ton of Diet Coke and Monsters and, crappy diet, and I exercised, but not really, just all the things. It just got to the point where I was so miserable and so like anxious and couldn't sleep and, like awake all night. And I just felt like I was falling apart, and I felt like my family was falling apart. I felt like my patients were falling apart, not because of me, but just because of other reasons. And all of a sudden, like one day I just realized that I couldn't continue to help my patients or my kids or my husband or myself if I didn't leave that situation. And the only way I could do it was just essentially to close that door and just completely walk away. I did have a sort of a plan, which was I was interested in integrative medicine and preventative medicine, the things we talked about, but I didn't really have a plan. It was just basically like, either you're going to stay here and you're going to die a slow death of like just being so miserable, or you're going to sort of jump off this whatever it is, bridge, and see what happens. And so that's what I did. And it's been an amazing 6 years. I've learned a lot. I couldn't be happier, but yeah, it was definitely a hard time there for a while.
No question. It sounds like it. And what was the thing that opened the door for you to get into this burgeoning field of anti-aging and regenerative medicine at a time where it seems like you got in there before it became really, really hot?
It was mostly just research, like internet research. I would spend hours, like whatever time I had free in researching, like what else can I do with my life? Like I'm not happy. Maybe I shouldn't be a doctor. Maybe I should be a business person, or maybe I should be a writer, or, like what else can I do? I learned about hormone replacement and bioidentical hormones and some of the things that some of these sort of new doctors were doing. And I loved the idea of being able to do medicine and still be in that field, but to be able to really help people in kind of a long lasting way, which I feel like in the ER, it's a tough world. Like you're doing, the doctors who are in the ER, the nurses who are there are incredible and they do amazing work, but you only have, 5 minutes with the patient and then they're gone, or you have 10 minutes, or, you can't, it's hard to make sort of lasting changes with a lot of them. So I like the idea of being able to do that. So it was just research. And then finally I went to a course and I was like, all right, this is what I'm doing.
Yeah.
And what do you love about your job now?
I love so much about it. I love being able to implement the things that I consider to be good medicine, even if they haven't sort of been adopted by the masses yet. We know in medicine, it takes about 10 years before something becomes standard of care from the time it's been shown to be safe and effective until it's, actually adopted by the medical system. And so I love the fact that because of what I'm doing now, I can take, look at the research and look at the studies. And if it seems like it's safe and effective, I can start doing some of those things, immediately. And I love traveling and talking to other people who are also doing things. I'm actually doing a documentary project right now where I'm traveling around the world to interview people who are doing some really cool stuff with stem cells, which we're not necessarily doing some of these things in the US. So these kind of opportunities where I'm just like getting to kind of soak up people's knowledge is like, they're amazing.
I love hearing your story where you have found alignment in your life and now it's just exploding in all these different ways and all these amazing opportunities. And it comes through like just you in person, it comes through your social media and all the exciting things you're doing in your life. And I know for me, somebody that's been in the sexual health space for just a few years now, I find it difficult to find some people out there that are having the real conversations, have the real knowledge, and can express that in a way that makes people think a little bit differently. And you are the perfect concoction and makeup of that. So like huge thank you for that, and in an area that really needs it.
Thank you. I think one of my sort of goals is to make sexual health something that we can talk about, not just on podcasts that are, focused on discerning dicks, but also like, at the dinner table or at, like at least in your doctor's offices. But, you could talk about it as being just a part of health. Like it's like, do I have a knee injury or do I have a penis problem? Let's go get those checked out and treat them kind of along the same, like they're both equal. They're both parts of your body that need to be optimized and need to be healthy.
They are equal. I've never measured my kneecaps though.
You have some girthy kneecaps.
And how do you measure them? Is it from the top? Is it from the bottom? I don't know.
Nice. You're supposed to know these things. Next time we bring you back, please have answers for us. This has been awesome. And Dr. Amy, to everyone else who's listening, but Amy to us.
Yes.
Where can everyone find you?
So my website is dramykillen.com. And then I'm also on Instagram at Dr. Amy B Killen. Same thing, Facebook, like all the things. Dr. Amy B Killen.
Yeah, and Killen is Killen.
Yes.
Yeah, you got such a Slayer name, Dr. Amy B Killen.
So much better than Brian Stacy.
It is.
Amy B Killen's awesome.
Hard name. Yeah. Thanks, Amy.
Thanks, Amy.
Thank you, guys.
Hey, thanks for listening to the Man Amongst Men podcast. If you enjoyed this episode, don't forget to hit the subscribe button. And if you want more access to tools and resources, and you want information on our upcoming live events and retreats, head on over to www.doinnerwork.com.